Hi, I'm Harriet Picker. I'm going to do a quick introduction to food allergies today for those of you who don't know about food allergies. So food allergies, oh, I see Ofra. Hi, everyone. I can see you all. I'm on a new laptop. Can't figure out how to get my video on. Oh, maybe someone can tell Ofra how to do that. Hi, Ofra. You got to see where it says the camera view. That's where you can click on that and you can see that's how you can get on. Okay, so getting back to food allergies. So many people think they have food allergies and they may not, but there's a difference between food allergies and sensitivities. Many people don't understand the difference between the two. One of the things that people should do if they suspect they have food allergies is go to an allergist and get 2 types of tests done, skin testing and blood testing. Neither one of them are 100%, but they do help make some, give some insight to it. The gold standard also is, if there's any doubt, there's something called an oral food challenge, which is where you eat the food that you suspect you're allergic to, or the tests have shown that you're allergic to, and you eat it in measured amounts under observation. And if you have a reaction, that is really the gold standard of whether or not you're truly allergic. Because you can have false negatives and positives to skin tests and to blood tests. The biggest factor, in addition to oral food challenges, is history. So if you constantly eat something and you have signs and symptoms, if you have symptoms like a stomach ache or something, that is something that the doctor would take into account more so than actually the skin or blood testing. So history always trumps everything else. Now, if you have a sensitivity, there seems to be like a lot of confusion that goes on around this. So examples of different types of conditions that people think are food allergies, which are really not food allergies and they're totally different, are lactose intolerance and celiac disease. Those 2 are not food allergies. Those are different types of conditions that we don't test the same way for those conditions, and they're not triggered by the same thing in your body. So very often, if someone thinks they're allergic to dairy, they'll say that they're allergic to dairy and that people automatically assume that they're lactose intolerant. Lactose intolerance is completely different than having a proven IgE-mediated dairy allergy, which is what a dairy allergy is when your body creates too much histamine. Lactose intolerance is when your body lacks an enzyme to digest the milk sugar. And that is completely different than having a dairy allergy. So someone who has lactose intolerance should not say that they're allergic to dairy, because they are not going to have a IgE reaction. They're not going to potentially have trouble breathing, hives, things like that. Now, with celiac disease, the same kind of thing. It's a little bit different. Celiac disease is an autoimmune disorder. And people think that, well, you're allergic to wheat. You can be allergic to wheat and not have celiac disease. Celiac is a problem where your body, your digestive system and other parts of your body do not break down gluten. So completely different. You're not going, yes, you have to avoid these foods with these with these conditions, but they're not the same type of reaction and the same type of system that gets affected when you have allergies. So many people say, oh, I'm sensitive to this or I'm sensitive to that, but but they're not allergic. So we really need to be very careful about how we describe things to people, because a lot of confusion happens. What? I heard you a little bit. I just heard you. I heard someone had I'm hearing Florida. Gosh, Ada, what was yours? Sorry. So that is, now I can hear better. So one of the things about food allergies is that we have our top 8 food allergies in the United States. Those are eggs, milk, tree nuts, peanuts, shellfish, wheat, and soy. And I think let's see, I forgot one. Peanuts, tree nuts, shellfish, wheat, soy, eggs, milk, and fish. Those are your top 8. And we have the unofficial 9, which is your sesame, which is becoming the most common one now, which is, it's becoming so common that there is lobbying on the FDA, to the FDA, that we need to get sesame labeled. Just so you know, if you have a sesame allergy or know somebody who has a sesame allergy, sesame does not have to be declared on the label, just so you know. So that is a huge problem. You have to learn how to read labels, which I'm going to talk about in a second. There are over 170 foods that cause allergic reactions. Now, we hear a lot about anaphylaxis, which is what I'm going to talk about. There are food allergy reactions, and then there's anaphylaxis. Just because you're allergic doesn't mean you're going to always have anaphylaxis. But just because you've tested allergic, we can't predict that your next reaction won't be anaphylaxis. So that is why whenever you get diagnosed with a food allergy, an allergist should prescribe an EpiPen just in case, because past reactions do not predict future reactions. So there's no prediction to say that if your first reaction was just a hive or two, to say that the next time that you have exposure would not be anaphylaxis. So it is best to avoid whatever you're allergic to, because you never know what the next reaction is going to be. So in terms of labeling, only the top 8 food allergies are listed on a label and that are required by law. So that is where things become very difficult for some people, because you can have food allergens outside of these top 8. There is a labeling law that was passed in 2006. It definitely needs improvement. If you are shopping for somebody who has food allergies, this is where it gets complicated. They do by law have to list if the item actually has the food allergy. They do if it has the food allergen. However, you may see when you go shopping on the bottom, made in a facility that processes peanuts, tree nuts, blah, 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 and it lists the allergens that way. Or it could say made in a facility, or it could say may contain. Those are not legal statements. Those are not legally binding statements. So they're kind of more like a cover your butt statement saying, look, we have these products in our facility, use it on your own risk. Each person with food allergies has their own comfort level using those types of labels. Sometimes it depends on the brand, sometimes it depends on the company. But for example, if I'm looking at this product right here, I know it's got glare on it, but like you would see here where it says ingredients and it will tell you the ingredients. But then there's an allergen notice on the bottom and the ingredients look fine, but then the allergen notice says product is a peanut and tree nut free facility using manufacturing practices. So they're telling you that if you have a peanut or tree nut allergy, they're going above and beyond that it's a peanut and tree nut free facility. Not every place will do that. And depending on what your family dynamics are, some people call up companies and don't go by labels, and they call every single label up and they're going to say, what are your on your lines? Do you process anything? Do you have peanuts, tree nuts, milk, sesame in your facility? There are honestly some people when I was working at camp that will not use products if they say it's housed even in their facility. So that is something that is an individualized comfort level. Something else that can be confusing to people, specifically people who keep kosher. Oreos, Ritz crackers. They're amazing. They taste good. They are marked OUD. But guess what? They have no dairy in them. They are totally safe for somebody with a dairy allergy. So they are totally, totally safe. But if you're going by the OUD, you would think it's not safe. So what exactly is it that's not making it safe? Nothing in the ingredients. The ingredients are totally, totally safe. And people have called up, if you stick to the original ones, they're made on equipment that is supposedly dedicated to not having any of those allergens that they're not listing on their label. But it is very tricky for people to go shopping and read labels. By law, any of the top 8, I'm going to say this again, any of the top 8 have to be declared. They have to either be bolded out in the actual ingredient statement, or on the bottom it has to say contains wheat, contains.
Hi.
So it has
I have
to.
internet at home, so I'm. So I'm here. I'm trying to install. A friend of mine's doing.
Fra, I hear you. You need to mute. You're not on mute.
I'm sorry.
So the labels will guide you to some extent. Again, if you have an allergy outside of the top 8, it won't work. You have to learn how things like natural flavors can hide allergens. So those are kind of like code words. Things like spices sometimes with a sesame allergy or mustard allergy can be hard to determine what they are. So that might be a case where you need to call up. There are cross-contamination issues, or cross-contact issues, which is why companies may contain, made in a facility, things like that. Again, that's all comfort level to people. So moving on, there's other kinds of food allergy sensitivity type of conditions that I'm just going to very quickly mention because they are up and coming. There's a condition that affects infants mostly called FPIES, which is a food protein intolerance, which causes a lot of watery diarrhea in infants. They can't break down the protein. It is a type of food allergy related condition, but it's a little bit different. It tends to resolve itself though as a child gets older, but it is based with the GI tract. Another condition that is now affecting people of all ages that seems to be also caused by food allergies is something called EOE. Carol, I don't know if you've ever heard me talk about it, but it's a new type of thing that we are seeing. It's called Anaphylactic Esophagitis, which basically is if you eat the food, you're not necessarily going to have anaphylaxis, but if you get a lot of feeling like GERD or like a lot of digestive issues, they now scope people. They find certain foods can actually aggravate that whole situation. So it's actually become more common as there have been more treatments for food allergies, like oral immunotherapy, which is where they give you small doses. Oral immunotherapy, which is where you give small doses of your allergen and you consume it and you gradually increase it. But there have been found more cases of EOE with people who are doing that. But it happens naturally on its own too, which is you don't present with hives, you don't present with classic food allergy symptoms, but you have this constant GI stuff. And what EOE basically is inflammation of your esophagus due to constantly eating something you're allergic to. So this is something that's kind of new. It's been around, it hasn't been around and aware as much as we know of your typical food allergy issues. So that's also something to keep in mind, because a parent may say that they don't need an EpiPen, but a kid may have EOE, and they still have to avoid the food. So you can actually, what they found in OIT is that you may rectify not having anaphylaxis, but you develop EOE and you still have to avoid the food. So just keep that in mind. What I have here is a food allergy action plan. So everyone who gets diagnosed with a food allergy should get one of these. They may look different. This is just a blank one. They've changed them now where they have pictures and faces, but it's been pretty clear of like what signs and symptoms you should look for. So it's important to know what's a mild reaction and what's a severe reaction. So mild reactions, you may just get an itchy tongue, an itchy mouth, and I'm going to touch upon another allergy issue right now before I move on, something called OAS, oral allergy syndrome. And many adults are actually complaining about this in recent years, and it really has to do with cross-pollen reactions. So if you're allergic to certain types of tree pollen, you tend to have reactions to like apples, peaches, carrots, cherries. Those kinds of things are a cross reactor, and it's really less to do with actually the food and more to do with the pollen. So that is something where you'll get like an itchy mouth or an itchy tongue. And it's different because you're not going to get hives and stuff, but it's called oral allergy syndrome because most of the symptoms are all in your mouth. So interestingly enough, people with OAS tend to be able to eat those foods that cause their symptoms if they're cooked, because it removes the cross-pollen reactivity. So if you eat carrots or apples or peaches or plums or cherries, those are all, most people who eat them, they can eat them cooked or baked. Whereas when you have other allergies, it's not so simple. Although there are some people who have egg allergies and can have baked egg. And there are some people with milk allergies, although my kids are not one of them, who can have baked milk. Because heat changes the protein. This does not change anything when it comes to nuts, sesame, or any of the other allergens. You may also hear a lot about airborne reactions. So there are, believe it or not, really very limited documented evidence about people being in the same room as a peanut butter or a sandwich or something like a chocolate bar and actually having full-on anaphylaxis. In fact, there's something that doctors are doing now called the proximity challenge, which many people don't know about. But the proximity challenge is where doctors will expose you, not to where you're eating it, but a proximity challenge to where it's in the room or in your vicinity. I know 2 doctors that go further and they actually rub it on your back to show a patient that they don't need to be fearful in being near the item. And unfortunately, lots of people have lots of anxiety just being near their allergen. So this proximity challenge is a great way to alleviate a lot of that anxiety. I know 2 allergists that keep an open jar of peanut butter in their office and in the cabinet, and then they tell the patient at the end of the meeting that, see, you've been in this room this whole time and you didn't have a problem. So if a parent is worried about that or a patient is worried about that, a proximity challenge is definitely something that doctors should be doing now to ease that anxiety. It is, however, possible to have airborne reactions if food is being cooked, and it's not limited to nuts. So fish, dairy, eggs, nuts, if they are being cooked and they're steamed, the vapors can create like a pollen-like effect in the air, And the protein, which is what people are allergic to when you have an IgE allergy, the protein does get into the air, and that can aggravate respiratory symptoms for someone who is susceptible, who has either asthma, who's already susceptible, or is very allergic to the item. So heat cooking, that's when it can definitely become an airborne issue. But just standing alone, it is not, the proteins are not released into the air. So kind of keep that in mind. But if it's a powder kind of substance, that's another way. So like Bamba or cheese doodles, those kind of fine powders can definitely release into the air as well. Just think about how if a tree shakes its pollen and that gets released into the air, it's no different. So mild symptoms of an allergic reaction are itchy mouth, a few hives, mild nausea, your stomach just doesn't feel right. Those are mild kind of reactions. So now if we're talking about going into anaphylaxis, which is a severe and potentially life-threatening reaction, which by the way doesn't only happen with food, it can happen, it actually is most common to happen with medications, believe it or not. Medication allergies cause the most amount of anaphylaxis. And then insect bites do as well, and then foods happen. But we tend to know about it with food. So anaphylaxis is a systemic reaction. It actually affects multiple systems of your body. And that is when you know that there's something bad going on. So like, for example, if you're wheezing and there's vomiting, if you have hives and your throat feels funny, that's a sign of anaphylaxis. Now, people think of anaphylactic shock, where someone closes up right away and they're like you see in the movies, and you fall down to the ground. That's not exactly what happens. So the technical term for anaphylaxis, when you're talking about it, according to one of these action plans, is when you are presenting with any of these symptoms. So like if you're short of breath, you're wheezing, there's this annoying repetitive cough, your heart, you can have issues like your pulse is weak, you can feel dizzy, you can feel confused, your throat can feel tight, your throat can feel hoarse, you can have trouble breathing, swallowing. There could be many hives all over the body, like a full body hive. I like to call it the lobster red rash, like your whole body turns bright red. You can have a combination of the symptoms. So when you see those are the times to use either an EpiPen or an Auvi-Q. And these are the only two medications that will reverse anaphylaxis. Antihistamines will help in terms of making you comfortable, but they will not reverse anaphylaxis. So these are what has to be done. Just in terms of right now, because we're in COVID life, they have put out a recommendation that if you don't feel comfortable going to the ER, they have recommended to give one epi at home and monitor and wait. The rule has generally been give epi and rush to the ER. Because of the situation in the ER, they kind of cut back on that recently. So that is a little bit of a change on that. But basically, food allergies present differently than sensitivities. And if you suspect you have one, you should definitely go and get skin and blood testing. You should meet with an allergist. You should describe the history of your reactions to it, because again, history is more important than all the testing in the world. And if you're shopping for someone with food allergies, always read labels and ask questions, and ask them always about their comfortability level. I'm going to open it up for questions because it is 1:30, so I know that I had until 1:30 to talk. So if anyone has questions.
You have as long as you need.
Oh, okay. That's good. Oh, now I'm hearing feedback. Okay. So
that's because I'm unmuted Neil, but I muted him back again.
Oh, okay. Mute Matt.
He's got the feedback.
Yeah, he's got the feedback. Yeah, you got the feedback, Neil. If there's any other, if there's questions about diagnostic testing, one of the things with EOE is they do a different types of test. They actually do a patch test where you wear the food. There's also, if you suspect you're allergic to other types of things besides food, there is something called a patch test where they put all these patches on your back with the allergen, and you can wear it for 24 to 48 hours. And deciding which one you develop the welts to, that is what they claim you're allergic to. I would not do sensitivity tests though that have been advertising on the online that you can find out what you're sensitive to and mail it in, and we'll tell you what you shouldn't eat. Those are not reliable. They're not proven by science. Another thing is some people do like hair testing or like muscle testing. Those are also not valid or proven ways to test for food allergies. So that's
I have a question.
Yeah.
So way back in the day, I had a lot of other allergies, not so much food allergies, but more sensitivities, I guess. But for certain things, they used to give shots. Do they still give shots? And does that have anything to do with food allergies or not?
Okay, so allergy shots were a really big thing, like many years ago. It is a type of immunotherapy, which I talked about.
Never worked for me.
It never worked for me either. So guess what? I'm still allergic to the things that I was allergic to. Well, maybe not as many, but it didn't work. Allergy shots are still given for environmental allergies, and it may work with OAS because, as I said, those are triggered by environmental issues. Right. They do not have allergy shots for food allergies yet. The type of treatment that they do have, though, for food allergies that are being explored, nothing is FDA approved, nothing's really on the market. You have to really find a doctor who's experimenting. So you can do sublingual immunotherapy, which is where they do drops under the tongue. They have that for food allergies. They have oral immunotherapy, which is seeming to be the most popular, most effective one, but also the one with the most risk, where you consume your allergy and you do increasing doses every week. But it's hard to do, and there does come the risk of having anaphylaxis. It's not risk-free, and there's also the risk of developing EOE. But it's the one that does give you the most likelihood of being able to not have anaphylaxis and consuming your allergen. There's also patches being developed, like Josh is on a milk patch, where he wears the patch on his back 24/7, which has milk that it gets delivered into his lymphatic system, and his body identifies the milk protein. And they do that with peanut also. The peanut patch is almost ready for FDA approval. They did just get FDA approval on another type of oral immunotherapy called Immune, which is a pill, which is basically with peanut powder in it. And the FDA has approved that to come to market. So people with peanut allergies may be able to start treating their peanut allergies with a pill, which is kind of interesting to do that. So there are some immunotherapies coming to market, but they're all being trialed now. So the allergy shots have been around for a long time, but they don't have them. Can't get a milk shot, can't get an egg shot, but they are looking at giving you small doses at small periods of time, different ways, either through your tongue, through your skin, or actually ingestion. Ingestion, again, has the best likelihood of you tolerating it. And
very interesting.
Any other questions?
Anybody else?
Rona has a question. Yes.
You can outgrow allergies?
Yeah, you can outgrow allergies. Allergies change all the time, which is another reason why you do oral food challenges, and they can change it. They did make that determination by numbers. So there are a lot of allergies that people can outgrow. So some people, there's like a 10% rate of outgrowing a peanut allergy, but I know lots of people who outgrew a peanut allergy, including my own son. There's a more likelihood of outgrowing an egg allergy and a milk allergy. Those are more commonly outgrown, but not always. And actually the milk allergy is being shown to last a lot longer than they have seen in the past. For adults, believe it or not, many more adults now are having adult late onset fish allergies. That is the most common allergen for adults to develop anaphylaxis to. Actually, adults are developing allergies later in life. So just as you can outgrow them at any point, you can develop them at any point. So that's kind of like an interesting new kind of development that is happening. So you can
find that a lot in environmental.
Well, environmental.
I think you should move.
Where though?
That's what happened to me. I'm just saying. I grew up in the South. I had horrible allergies, not food, no food allergies, just environmental. I moved to New York, and I've been perfect since then.
Well, they used to say move to Arizona, and you know.
No, but that's different now. No.
But now we brought those trees out there, so the same trees are there. It doesn't make a difference. There are people like when I was doing a lot of field work with the Puerto Rican community. A lot of people would come to me and tell me that when they were in Puerto Rico, they did not have any issues. And then they moved to New York, and all of a sudden they're dealing with asthma and they're dealing with environmental issues. What happened? So yeah, it can happen if you move from place to place. And you can develop allergies at any point in time to something that you've consumed a million times. Like people can eat fish a million times and then all of a sudden they have an allergen. So an allergy reaction to it. So just because you've never had an allergy to it doesn't mean you're not going to develop allergy to it. So that's something. But
be careful feeding your fish.
Yeah.
My husband really had an anaphylactic reaction. He never shellfish.
Mm-hmm.
And it turned out that's what you feed fish if you have tropical fish. And he was very ill over that.
It can
because
happen.
That's the krill in fish food can really do you in. So be careful.
Well, believe it or not, dog food's also a problem. People who have nut allergies, a lot of times they put peanut butter in dog food. And and so what happens is if the dog licks the kid or licks an adult with an allergy, they can have a reaction. So you do have to know what you're feeding your pets as well, believe it or not. Potting soil, another great thing that we have at camp, and I don't know if we're doing camp this summer, but we'll see. One of the things that I'm always careful about at camp is potting soil can have peanut hulls in it. So that's another tricky place where allergens can hide. Also note that any beauty or hygiene products do not have to list allergens by law. And so you really have to read the ingredients, especially with the, people wanting more natural type stuff. More natural means more food allergies, or even environmental allergies because they use different types of flowers and they use different types of seeds and things like that in their products, even lipsticks. So you really, if you have any type of seasonal allergy or even food allergy, you have to be careful when using some kind of beauty product or shampoo or moisturizer because it all can be in there, believe it or not. Bringing Rona's point about fish, a parent contacted me about a couple of months ago. Costco, or you know how we like to now put DHA or omega-3 in our orange juice or milk? Well, some companies are sourcing that from fish. And so you don't even think about reading your milk and then all like milk would have fish protein in it. Yeah, milk would have fish protein in it. So it's really kind of something you need to read. Same thing with fortified orange juice that has these things put into it. They can put fish protein in it, and if you have a fish allergy, it's a problem. Same thing with kosher marshmallows, by the way. Kosher marshmallows are made out of fish gelatin. So if you have a fish allergy, you can't have them. So there are sneaky little ways that allergens can go in. Carol, you have a question?
Yeah. So in what you just said, like milk and OJ, is it stated on the label that is in there?
So the ones that I've seen, it's on the bottom where they'll say contains fish. But then you'll have to go looking, like, where's the fish? Like, where is it? So it doesn't always say. So like, if you know it's going to have like a fish oil in it, that's where you need to look. So a lot of times omega-3s are coming from fish.
Right.
That's where you need to be careful. What's the source of their omega-3? And you'd have to kind of hunt that down. So it's interesting how certain things can be hidden. Dustless chalk. How many of us all know about dustless chalk? I mean, in the classroom, I'm always around dustless chalk. Dustless chalk has sodium caseinate in it, and it is a milk product, and it has been shown to aggravate asthma symptoms in children with milk allergies. But it's not declared, so there's that. There's lots of different ways. Or finger paint. Finger paint could have an egg based on it, and that's how you also have to look if finger paint has egg in it. There's a lot of products that you're not necessarily thinking about eating, but you come in contact with the food allergen at the same time. So it does get difficult in that aspect to manage it. Like checking on shaving creams, checking on different types of toothpaste. One of the toothpaste, I think I use Sensodyne, which I believe has sesame in it. Or, for example, like those chapsticks that have all the flavors, which I love. They have like the Coke flavor, the raspberry flavor. Those types of lip balms, lip smackers, they're called. They're all sesame oil based. So if a person has sesame allergies, they can't use it. It's a problem. Or how many of you, when you've gotten your manicures, they use almond oil for the cuticle cream? So these are all sneaky little ways that allergens all come into our environment. I saw Neil asked a question, what do I think about nut-free schools? That's baiting me. He's baiting me because I feel very strongly against nut-free schools because you have so many food allergies nowadays. It's unfair to create a policy that protects one that doesn't protect all the possible ones. Most kids with a food allergy have multiple food allergies, and the person who's allergic to peanuts, the next person can be just as allergic to, let's say we swap it out with sun butter. So they could be allergic to sunflower seeds, or we swap it out with soy butter. That risk is still the same to that child who's allergic to the soy. So I'm more about creating policy that covers everyone with a food allergy versus singling out one specific, make a nut-free rule that doesn't really, that only protects one group of allergens. And we need protections in place that protect everybody. And now it's really easy to protect people with food allergies, which is washing our hands. Guess what? COVID has made it so much easier for people with food allergies because a lot of the stuff that we need to do to protect ourselves from COVID now is what people with food allergies have had to do all along, which is which is washing our hands. And if you eat your allergen, wash your hands. The person's allergen, wash your hands before and after eating for the happy birthday. So you have to do that regardless. We're not supposed to be sharing food. So that's another thing. You don't want to be sharing something to another kid. So we implement no sharing policy. Wiping down tables and surfaces. That's what we were doing with food allergies anyway. So a lot of this stuff that you do to protect someone with a food allergy is just basic good hygiene. And now we have to do it. So by creating a policy for COVID about wiping down tables and washing hands, at the same time, you're protecting people with food allergies, which is great. And so the limitations are even less. So just keep that in mind, that is the case. Any other questions? No? All right, I see Oprah's there. I didn't see Oprah send me any questions, but okay. All right.
Thank you so much. This was very informative.
Thank
And
you.
it's interesting how so many things
Oh, I think
cause other things and other issues, and it's like,
yeah. What I didn't go into on this session, which I could have done, was I have a nice little chart that shows the percentage of cross-reactivity, meaning if you're allergic to one food, what is the chances that you're allergic to another food? So for example, if you're allergic to dairy, there's a 10% chance that you're allergic to beef. And if you're allergic to one particular tree nut, there's a more likelihood that you're so for example, if you're allergic to cashews, there's a high likelihood you're allergic to pistachios, but you may be totally fine with almonds and hazelnuts. So there's like a whole percentage that things can their proteins are so similar that you can cross over. So that's safe for another time, but yeah, you can definitely, when you have one allergen, there is potential for crossover for another.
Thank you.
well, thank you so much. This was awesome.
Thank you. Stay well.
All right, take care.
Bye.
Bye.